Hello everyone. Today I will show you a short introduction to acupuncture. Acupuncture has spread to the whole world and been accepted by patients all around. It's cheap and convenient, easy but effective. In this section, I'm going to show you two parts: what acupuncture is and how to operate a needle. Okay, let's get to the first part. What is acupuncture? Acupuncture is a therapeutic method that a needle is stuck into a particular spot of the body to produce a therapeutic effect. Acupuncture has a very long history that can date back to 10,000 years to 4,000 years ago. In ancient times, our ancestors sometimes suffered from some kinds of pain, joint pain, lower back pain, abdominal pain, etc. They found by chance that when their bodies were pierced by something sharp, like a sharp stone or thorn, their pain was alleviated. So they began to use some sharp things to stimulate certain areas of the body and sometimes make them bleed on purpose. Gradually, acupuncture was developed. The form of needle has changed with the development of technology. At the very beginning, when it was about Stone Age, needles were from nature, sharp stones, sharp bones, or maybe thorns. During the Metal Age, needles were made of bronze, copper, silver, or gold. Nowadays, needles are made of stainless steel, which are disposable or reusable. Now, let's get to the next part: how to operate a needle, including those following procedures. The first step is to insert a needle. Sterilize your fingers and acupoints with an alcohol cotton swab. Then take out the needle and hold it by the tail with your index finger and middle finger. The angle of needle insertion also has its requirement. According to different tissue depths and different acupuncture points, the angle can be classified into three types: perpendicular, oblique, and transverse. Perpendicular insertion refers to inserting the needle perpendicularly, namely at an angle of 90 degrees to the skin, in most points of the body, especially in the sick muscle regions. Oblique insertion refers to inserting the needle obliquely, namely at an angle of 45 degrees to the skin, in the points located on the thin muscle regions or close to internal organs like the neck, waist, and the chest. Transverse insertion refers to inserting the needle almost horizontally, namely at an angle of 15 to 25 degrees to the skin, in the points of the face and head where the muscle is thin. After inserting the needle into an acupuncture point, you have to manipulate the needle. There is a very important definition: needle sensation, which means a special sensation of soreness, tingling, distension, or heaviness experienced by the patient, as well as heaviness and distension felt by the clinician. In order to cause a needle sensation, you have to insert and withdraw the needle several times like this. The purpose of needle manipulation is to induce needle sensation and to transmit it, and to reinforce or reduce the effect. Reinforcement is used in the condition of deficiency syndrome and reduction in excess syndrome. And then we get to the third step: needle retention. There are two types of needle retention methods: lifting thrusting method and the twirling rotating method. Lifting thrusting method refers to lifting up and thrusting down of the needle, and twirling rotating method refers to twirling or rotating the needle clockwise or counterclockwise. Please do not twirl in one direction. Time for needle retention usually lasts 10 to 20 minutes. When the acupuncture is done, we have to withdraw the needle. Press the puncture site with a sterilized cotton to prevent bleeding and check the number of the needles. The patient should keep the points clean to avoid infection. It is easy to operate a needle, right? Okay, now I will show you two important acupuncture points. One is 曲池. When you bend your elbow, it's right in the middle of the line, connecting the lateral end of the cross striation of the elbow and the lateral epicondyle of the humerus. It is associated with the pain in the shoulder and elbow joint, upper limb paralysis, hypertension, urticaria, influenza, acute gastroenteritis, etc. The other acupuncture point is 合谷, located on the dorsum of the hand. It is between the first and the second metacarpal bone and on the midpoint of the radial side of the second metacarpal bone. It is associated with fever, headache, toothache, sore throat, nosebleed, facial paralysis, motion sickness, etc. Okay, that's the end of this section. See you next time.